So this commenter asks a great question about the potential link between irritable bowel syndrome, or IBS, and anxiety. And I'm going to answer in two ways. First, the easy way, yes, there is a link seen in the literature, and I'll post a sample study below. But now the more interesting answer. Describe for me anxiety right now. How you know when you're anxious. And you're not allowed to just use synonyms. You can't say, well, if I feel nervous. And consider how many of those symptoms are physical symptoms that are sympathetic, meaning they're activating symptoms like flushed red face and a grumbly tummy. The overlap between the symptomology of IBS and anxiety is profound. And that actually means two things. First, if you are having the symptoms, it can be hard to figure out which one you might even be experiencing. If you start to have those butterflies in your tummy, is that because you ate something that didn't sit right with you? Or is it because you're nervous or anxious about something that just happened? And second, anytime we have some kind of symptom overlap of this kind, where there's a psychological overlap, you can often incorrectly ascribe the symptoms to the psychology. And what I mean by that is, if you start to have those butterflies because you ate something wrong, but didn't realize that's why, you might start to say, I'm anxious, I wonder why, and then retroactively, you actually start to build a story for yourself about what you must be anxious about, because usually you can find something, right? And then you have a positive feedback loop potential too, meaning once you identify that thing, you might start getting more and more anxious about it, which is going to make the stomach feel worse. And now you have an anxiety sort of IBS loop. And so it can be really hard to decouple the two. And sometimes, again, one might even cause the other. So that's the best answer I can give you for now, and really appreciate the comment as always.